Hello and welcome to this video cast for the PCR-EAPCI textbook. And with me today, it's my great pleasure to introduce Dr. David Adlam from the Leicester Biomedical Research Unit in the United Kingdom, who is an authority on a topic that he's the senior author for, called spontaneous coronary artery dissection, which is being released at the PCR Congress. And without further ado, David, could you just summarize for us briefly the aim of the chapter and why awareness of spontaneous coronary artery dissection, which goes by its well-known acronym of SCAD, is important for clinicians and particularly interventional cardiologists?
Yes, so thanks, Rodney. So, I mean, SCAD is, if you like, increasingly recognized now that we're doing coronary angiography earlier in the disease course of patients presenting with ACS. We're identifying more and more of these patients and recognizing them. It's really important for interventional cardiologists to understand, if you like, or recognize the angiographic features of the condition, but also to have that index of suspicion with more borderline or gray cases to be able to pick those out for additional investigations, particularly intracoronary imaging. And of course, this is a condition which affects primarily women, including a minority occurring in and around the time of pregnancy. And critically, again, for interventional cardiologists, they behave differently during PCI. So to some extent, it's your trickiest case in a sense, that potential that you have to get up in the night to see a pregnant or immediately postpartum woman who's got a catastrophic coronary dissection, and how do you deal with that? How do you recognize it, and then how do you address it?
Thank you. I mean, the chapter is very comprehensive, and thank you for such a great piece of work. But can you just summarize some key take-home messages from the chapter that might be useful to the busy interventional cardiologist?
So from an interventional perspective, I guess the key things, first of all, are recognizing it. So SCAD is something which looks different from the sorts of dissection that sometimes we see in interventional practice as a result of iatrogenic dissections. They look differently. Often they're this, if you like, intramural hematoma, a long, smooth narrowing. So obviously being able to make the diagnosis is critical. From an intervention perspective, also it differs from other forms of ACS, where we obviously reach for stents in many patients, and certainly we're thinking about revascularization. Whereas with SCAD, if you like, it's at the opposite end of the spectrum. We're trying to be as conservative as possible because we know that the complications from PCI are much higher in this population, and that they can do very well for conservative management if that is possible. So if you've got, a more distal SCAD or a SCAD with good flow, then conservative approaches, patients can do very well with those. So there are key differences between this condition and atherosclerotic ACS. And I guess that those are the most important messages, because obviously we see mostly atherosclerotic ACS as interventional cardiologists. So you've got to be able to spot these and if you like, manage them differently.
Thank you. And in terms of future directions or studies, research programs that are, I know that you have an active SCAD unit yourself. What do you think the future holds in terms of that direction?
So we're actively engaged at the moment. It's just sort of getting started in a European registry, which is supported by the European Observational Research Programme, EORP, under the auspices of the ESC. So we would encourage all of our friends and partners across Europe to participate in that registry. And we also are looking forward to clinical trials in this specialty. And that is something that actually is getting started right now with partners in Europe who have got funding to start these first clinical trials looking at pharmacological management in this condition. So I think it's a really good time to get involved in SCAD research. And of course, because it's a less common disease, we need everybody out there to participate in order to be able to answer the most important questions that we all want to see answered.
Thank you very much. That's an excellent summary. Thank you very much. And I encourage all those who are visiting the stand electronically to take a look at this this chapter. It's very well written, it's comprehensive, and is a very important addition to the textbook program. Thank you very much.
Thank you.